At BTK, we have heard several trials about BTK inhibitors. So now there are 2 BTK inhibitors that have been used in trials that besides Ibrutinib, it's Acalabrutinib and Zanubrutinib. So we have seen data on those 2. I think what's interesting is in Acalabrutinib, across the trials that have been presented, we can see that there is a hope to have less cardiac events than with Ibrutinib. I think it's something that is repeated across the trials. And of course, there are some headaches, but they seem to be manageable in terms of intensity and duration, maybe with caffeine. And besides that, it seems that concerning the hemorrhage and bleeding problems, it might be less, it might be identical to Ibrutinib. It's a bit difficult to judge because some patients in the trials, the patients who are at risk, like with anticoagulants or antiplatelets, are not included. So that's one point. With Zanubrutinib, it seems also that the cardiac events are less important than with Ibrutinib. It seems also that there's a hint that yes, association of Zanubrutinib with anti-CD20 might be more efficient than when we add an anti-CD20 to Ibrutinib. So these 2 are going to move forward. Depending on the country, we don't always have access to these drugs, but we'll probably soon have. And it's interesting to know that we have challenges for Ibrutinib. And the BTK inhibitors are very much moving forward. Concerning the efficacy, I don't think that right now we have any clear data that says that any of these BTK inhibitors is more efficient than the other, but it will probably be challenged within the next years.